Hello, my name is Michelle Cervantes. As part of the MUW BSN program, myself, along with Siobhan Doyle, Shawana Young, and Julia Wooten have prepared a presentation on systemic lupus erythematosus. Systemic lupus erythematosus is also commonly known as SLE, and I will refer to that throughout the presentation. We do have some objectives. After completion of this presentation, the learner will be able to accurately define SLE, identify who is most likely to be affected by SLE, identify risk factors of SLE, identify hallmark signs and symptoms of SLE, explain basic disease process of SLE, and list diagnostics used to diagnose SLE. So what is SLE? Lupus is an autoimmune disease. This means that the body's immune system attacks itself. It attacks healthy tissues instead of attacking only things like bacteria, viruses. This causes inflammation. Systemic lupus erythematosus is the most common and most serious type of lupus, but there are other types of lupus. SLE is a chronic disease and has no cure. Early history, articles describing what we now know as lupus can be traced back to the ancient Greek physician Hippocrates. Hippocrates was born in 460 BC, and he wrote about the severe red facial rash, which we now recognize as a classic symptom of SLE. The word lupus is Latin for wolf. The term lupus was first coined by the physician Rogerius in the 1200s, who used it to describe erosive facial lesions. According to one account, the distinctive butterfly rash associated with lupus resembles the bite marks of a wolf attack. The other theory says that the frightening facial marks on people's faces were similar to the distinctive marks on the wolf's faces themselves. SLE from the 1800s to 1900. In the mid-1800s, leading Viennese physicians Ferdinand and his son-in-law Mortiz Capozzi were the first to formally recognize the symptoms of lupus, that they extended beyond the skin and affected the organs of the body as well. The term lupus erythematosus was first used in 1851 by the French physician named Pierre Cazanet. Lupus is the Latin word for wolf, and erythema is the Greek word for redness or blush, so that's where they get the lupus erythematosus. Between 1895 and 1903, Canadian physician Sir William Osler wrote the first complete formal document on lupus erythematosus. Dr. Osler also identified that lupus could be systemic, that it could affect the entire body, not just only one part. He also noted how lupus could relapse and then flare up later in later months. SLE in the mid-1900s. In 1941, Dr. Paul Kepler and his colleagues at the Mount Sinai Hospital in New York City wrote detailed pathological descriptions of lupus. They coined the term collagen disease, which led ultimately to our modern classification of lupus as an autoimmune disorder. In 1946, Dr. Malcolm Hargraves, a pathologist from the renowned Mayo Clinic, published a description of the lupus erythematosus, or the LE cell as it's referred to. This important development identified the systemic inflammatory part of the disease and allowed doctors to diagnose the disease faster with greater reliability. In the 1950s, the LE cell was shown to be a part of the anti-nuclear antibody reaction. This led directly to the development of a series of tests for the antibodies. These are the so-called fluorescent tests, which detect the antibodies that attack the nucleus of the cells, the ANA, and that is actually the test that is used today to detect SLE. Incidence of SLE. The Lupus Foundation of America thinks that about 16,000 new cases are reported across the country each year. SLE makes up about 70% of all cases of lupus, and it's hard to guess how many people in the U.S. have lupus because the symptoms are so different from person to person, and sometimes it's not diagnosed at all. Who does SLE affect? Anyone can get lupus, but women are more likely to get lupus than men. About 9 out of 10 adults with lupus are women ages 15 to 45. African American women are 3 times more likely to get lupus than Caucasian women. Lupus is also more common in Latina, Asian, and Native American women than Caucasian women. Men are at a higher risk before puberty and after the age of 50. 2/3 of the people who have lupus before puberty and after 50 are women, so women are by far more likely to get lupus than men. And that concludes my portion of the presentation. Thank you so much.